The basic reproduction number of a virus, or the R naught, is a mathematical model that refers to how contagious an infectious disease is. So as it spreads to new people, it actually reproduces itself. And what it refers to is, more precisely, is the amount of people on average who are going to get contaminated by someone who's been infected by COVID-19 at the beginning of the pandemic, when the population was previously free of the infection. And of course, that rate is actually going to change with time, but also region to region and country to country. It's correlated to other factors that are taken into consideration, like, for instance, the period of contagion. So the longer a patient is contagious, the more likely he is to contaminate other people. The amount of people that person has been in contact with, but also what type of virus it is and how it transmits itself. So is it airborne, for instance? Of course, it's important to say today that scientists do not agree on what the R naught of the virus is. Here in France, we're talking about 3.3. Elsewhere, you can hear the number of 5. And if nothing is done, then you're going to stick with that R naught. But if a population starts washing their hands more often, wearing masks, staying a little bit more at home, or even being on lockdown, that's going to reduce the R naught for a time. So for instance, here in France, the lockdown has reduced the R naught from 3.3 to under 1. And that's what epidemiologists are trying to do, to get under that threshold of 1 when the virus doesn't find enough hosts to be able to infect, so that the virus can stop by itself. It's important to say that there are other infectious diseases that have an R naught that is much more important than coronavirus. For instance, measles, with an R naught of 16.